Yes, indeed. So that's giving you snippets of the task ahead of us, the challenge that we face, and what we need to do about some of this. So now we're joined by Dr. Thomas Wilson Kubese, who is the convener, Yes We Fit Revolutionary Movement, and he also did vie for the #1 seat in the country. Thank you for coming on this morning.
Thanks for having me, Chamberlain.
Well, as we await the ministerial list, different positions, but one wonders if they usually just have this at the back of their minds when they're submitting those names. This is where you're going to tackle. This is your ministry. But the challenge is the country is replete with, what we see here at the moment. We know that the ministry, the government, they launched the second National Health Strategic Plan last year after they won the first one, elapsed in 2015. So from what you've seen now in terms of our approach to tackling the health sector, how would you say we're fared?
Thank you, Chamberlain. Let me start by giving my condolence to Ruben Fashionati and Mr. Olakunrin over the demise of my sister, Mrs. Funke, 3 days ago. 2 days ago, I was still with Ruben Fashionati to condole with him. And it's a national discourse today because an important person is involved. But this happens every day on our roads, in our cities and villages, and for the people that have no voice to be heard, for them are wearing this black and black today. And I appeal to President Buhari to please do the right thing and stop this. He knows what to do, he knows how to do it to stop this. I only pray that Allah should give him the will, political will, to bring this to an end in the interest of our nation. Now, to your question about health, what we have happening in the health sector is actually a reflection of what we have in the entirety of the system. As we have dilapidation in the health sector, you have in the educational sector, virtually all around the sectors, we have the same thing. In 2001, African nations came together in Abuja to form what we today call the Abuja Declaration. And in that declaration, it was stated that the budgetary allocation for health for every African nation should be at least 15%. But since then, we've not been able to meet up to that. Some African nations have actually met up to that, and they have surpassed that 15%. But in Nigeria, we've not been able to meet up to 15% of budgetary allocation for health. And that explains why you are seeing the things that you are seeing today. So the first thing that we'll need to do is to have a budgetary allocation. Even the NMA is asking for 21% as budgetary allocation for health. If we do not have health properly funded, the dilapidation we are seeing today will continue, and that's why we are majorly where we are today.
Is that the reason we are rated so poorly by the World Health Organization?
The rating of the World Health Organization for Nigeria, you wouldn't take that away also from how we run our NHIs. NHIs has been in the pipeline since 1999, eventually kicked off in 2005. Since 2005 till now, we've not been able to cover 10% of the population, less than 10%. The informal sector is not covered. Most of the states are not on NHI scheme. So we find that it's running as if it's not running. And so many anomalies in the system also that I quickly want to mention. Number one is the fact that, like you heard the Honorable Minister mention now, that most of the tertiary hospitals are overburdened. Why are they overburdened? Teaching hospitals today are doing primary care. It is an anomaly. You have malaria, you're going to the teaching hospital to be treated. You want to fill your NHI's form, you are choosing the teaching hospital, you are choosing FMC, Federal Medical Center, even the general hospital. This should be referral center. They should be strictly for secondary care. There are some recommendations we must take to note, which I think the incoming Minister of Health must implement if NHIs will be functional. Number one, every center will choose either to take care of primary care or secondary care. In other words, when you go to the NHI's office and say, okay, I want to fill the form for NHIs, you fill your primary center. Teaching hospitals, federal medical centers, general hospitals should not be in the primary care. They should be referral center. If we do that, we realize that the larger chunk of the funds in primary care that we call capitation will go to the basic health center, the primary health care center, and the private hospitals. Now, when those people cannot manage certain cases, they now refer to the higher centers. So our teaching hospitals will be less burden, the people who are there will be better funded, and the system will begin to work.
It would seem then that what we have at the present is a health system that is not structured. Is that what you're saying?
It is structured, but it's not functional.
But you just said now that we have primary care needs being referred to secondary health centers.
That's right. It's supposed to be in stratum. The way teaching hospitals are designed, they are designed to be referral centers. When you have a case that you've been managing from lower centers and you're not getting the results, or you don't have the personnel that should handle such cases, then you refer them to the teaching hospital.
Which is why I asked if we have a structured health center. That system should flow, just as you said.
Yeah, on paper, that's what we have. But unfortunately, that's not what we have seen. And that's why I said, as far as the NHIS is concerned, that is an anomaly that should be corrected. The second anomaly that must be corrected in NHIS is that you as an enrollee, for instance, if you go to your healthcare facility and they treated you in a way you're not comfortable with, you just go to the NHIS office and say, sorry, I want to change. And you change the healthcare facility immediately. But you cannot change your HMOs. The HMOs are the intermediaries between the federal government and the healthcare facilities. Now, most times, the hospitals want to treat a patient and they say, please give us code for this patient. And the HMOs will just decline code. So you treat them at your own expense. A lot of things they come up with because they know that they cannot be changed by the enrollee. So the change will happen in NHIS the day the enrollee has the choice to choose his HMO, the same way he has a choice to choose his healthcare provider.
Beyond the HMOs, you said it's just about 5% that's captured under the HMO scheme. So I can imagine that a whole lot more should be put into perspective with a view to having more Nigerians having access to primary health care for them. Is the current, or should I say the minister, how would you assess his performance in terms of getting healthcare to Nigerians beyond the NHIS?
When you are appointed a minister, the word minister is to administer the vision of the presidency. That's why I'm not too keen. People are saying that President Buhari should announce his ministers. We're going to 2 months now. It's not as much as the announcement, but as much as the documentation of the roadmap. Where is the roadmap of this administration for health in the next 4 years? So the minister comes in and implements the president's vision for health over the term
but there is one
administration.
Second National Strategic Health Plan is there.
Yes.
Yeah, it's beautiful. See, Chamberlain, those things are beautiful on paper. You see, when we talk about implementation and the microcosm of the implementation, you realize that some of these things are not exactly, the way they are put when it comes to implementing them on paper.
How do you mean?
Yes, what I mean is there is a vision. Okay, let's give an instance. You go to most of our teaching hospitals. They are not functioning. The system is not working. Today, Nigerian doctors are the highest in number that travel out of their country. We train them, they don't stay here because the system is not caring for them. Okay, so when we talk about the planning, for instance, saying that, okay, in the next 4 years, we're going to build the primary health care system with this, and this method. The secondary centers, the tertiary centers, this will be the plans that we are going to have. I'm talking of specific plan, not just things you just put up and say, okay, we are going to have this, and you are not even providing the funds to make it happen. That's why I said it's one thing to just put some things on paper. It's something else to really provide the fund and the personnel to make it happen. Is it the
funding to make it happen or the personnel as well? Because, I mean, you go to many people, I'm sure you read the papers as well, many people would complain and, about the people who they meet, the healthcare givers at the primary health center and the secondary health centers that you talked about. So even that, wouldn't that be an issue?
You see, the moment you are dissatisfied, you are here working for channels, television, you are having job satisfaction. That's why you're still here. That's why the three of you are still here. The moment the system is not giving you the job satisfaction that you have. I have a colleague that just traveled to the US last week for training that was sponsored by WHO. How many of our doctors are sponsored by the federal government for research? How many of them are sponsored for programs that will enhance their proficiency? So it's one thing to put things on paper. We're saying that the system, the way it is structured, health, starting from the budgetary allocation, like you say, is not functional. And like I did mention, if today the president say, okay, Minister for Health, in the next 4 years, make sure that 90% of Nigerian population is covered by the NHIs, you'll be amazed the kind of transformation that will happen. It becomes a compulsion.
Well, you said the other time that it's a function of the system.
That's
Systems
right.
don't run themselves. They are run by people.
Yes.
So what do we need to do? Because, I mean, the guys just mentioned this national plan of the federal government. It's not going to run itself. It's going to be run by people. So do we have the people to run it?
The people are there to run it, but the enablement for them to run it is the issue we're talking about. You know, when you put things on paper and you do not give the enablement to make it function, then it becomes like a caricature.
What is this enablement you speak about?
The enablement, one, begins with the budgetary allocation. Like I did mention, the Nigerian Medical Association is asking for 21% of funding for the healthcare. If you're not having enough budgetary allocation, you realize that the system cannot work. If, for instance, we say, okay, over the next 4 years, we're going to face about some hospitals, teaching hospitals in each of the geographical regions in Nigeria and equip them to international standard and make it functional. These are specific things. If you're saying that the primary healthcare center will take care of primary cases and tertiary centers will take care strictly of tertiary cases, you are stratifying, you are giving enablement for the centers. But when everything is modeled up, you realize that the system itself becomes confused.
The Minister of Health has appeared several times before the Senate Committee on Health. He's itemized these issues. He's talked about specific plans in terms of what they're doing, how they're funding basic health care in different states. That's addressing funding challenge. And if you're saying that, yes, federal government needs to do some of these things in phases, where then is the role of states? Because that's very key, because primary health care is a function of local government and states.
Health is on the concurrent list. That means that the federal government...
Conjointly do.
Yes. The federal government can legislate on it as much as the state government can also do the same. And this is where the impact of the federal level comes in. And if we say, for instance, if the Mr. President giving an instruction...
For the tertiary part?
Yes, for the tertiary part.
The local governments and states
yes.
can also do primary and secondary part.
Of course they can. But again, it's a function of the budgetary allocation. You only work with what you have. You cannot go outside of the budgetary allocation that you have.
Yeah, but if I could pick up on some of the issues you raised earlier, which has got to do with now, let's even look at the funds that we've provided already.
Yeah.
What has happened in terms of the implementation and the conduct of it. Today, I mean, getting to any of these facilities, the conduct of the professionals there, or the health caregivers, raises a lot of questions. And then people talk about the medical and dental council, their role, their functions. Some of the doctors to the nurses. I mean, every citizen, most of them, if you ask them, they'll tell you, look, there's a huge problem in terms of that. So those are the first people, don't you think, that should address their conduct in the bigger picture?
You know, I was watching a protest 2 days ago online. I think it was in Kogi State. And some of the workers there were protesting not having been paid for 36 months, Chamberlain. Some of them are local government workers. And you expect a man who has not been regularly paid to make you happy as a patient? Now, it's not just in Kogi. In some other states, we also find the same thing. That's
Granted, but before then, they were paid.
Mm.
And so many will say it's not a function of payment. It's the conduct, the professional conduct. I mean, the conduct is not as professional as he ought to be. So this is not a question of pay.
You can't take away job satisfaction.
Yeah, but you say you haven't heard that complaint.
No, it's there.
Are you limiting it to just a function of pay?
It certainly can't be just a function of play. So many factors come in. You know, before you give in your best, you look at the fact that, okay, when I finish from here, what's the future for me? What's in the job that I'm doing? What's the job satisfaction that I'm getting? You know, but when you come into the health system, you realize that there's a lot of stratification, you realize that there's a lot of infighting in the house among different professions also. So some of these things are also factors.
So if they provide all the funds they need, this is still going to be a problem.
Now, talking about the interprofessional fight in-house, the doctors, the pharmacists, the nurses, that is a different thing altogether. We can't take those things out, but with time, if you have a proper direction, that will be handled. But the funding, as long as the funding is not there, everything you're saying will just be on paper.
I know, ASU also talks about funding, and most of them talk about funding, but look at the libraries, look at the it's a big challenge. Yeah, but we'll have to live with that.
Especially for women.
Having
babies.
Yeah. Okay. We have to thank you for coming on. Dr. Thomas Wilson, Equivalent Head Medical Practitioner and Convener, YesWeFit. Thank you for coming on.
Thanks for having me.
All right, we're back in a moment. Stay with us.